Good afternoon. I hope I think that Dr. Požlep made a good introduction to integrative health management, but perhaps here in Slovenia is not so managed so good as in United States. I would like to say I'm very thankful to my mentor, Associate Professor Dr. Winter, who encouraged me to go this way. And she also introduced many methods of non-pharmacological treatments and also education in Slovenia, because some years ago we started, Dr. Winter started acupuncture school. Before we didn't have it. And also I was visiting the courses of medical hypnosis 10 years ago, before it was not well developed, this kind of education in Slovenia. So that's why we are in the beginning of the story. I will start with the content. I will just show you one of my cases. I have a lot of cases, but I will just show you one case of integrative approach in our clinic. And then my colleague will show some of research, which is also in the very beginning in our country. So I will be very happy if you will be patient with us. So as I told you, I hope also in the future we will have some kind of national center for complementary and integrative health in our country. It is connected to European Society of Integrative Medicine, but just the terms, not to have misunderstanding during my lecture. Complementary means non-mainstream approach in combination with conventional medicine, and alternative approach means non-conventional in place of conventional. But integrative health or treatment means coordination of both. So just to speak the same language. So we can see if we search the website of National Center of Complementary Medicine of United States, it is very good managed, and I was so happy to find this e-pain book, and I hope we will do it in the future also in our country. So there are pages for patients, pages for researchers, and for doctors, for everybody. So we still don't have this. My clinical case is a 30-year-old man. He is an ex-soccer player and a physical worker. He came to my office with a huge pain. Intensity was around 8 to 9, and he had stiff neck. And without fresh injury, but when we were talking, he told me that he is having also a mental stress, fighting for his child with his ex-wife. So he was treated in general practice with analgesic, and he had problems because of non-steroid drugs. He had gastritis, vomiting. And then we were talking, and I educated him, like Dr. Požlep said before, the education. So he understood what is his pain about and what can be the reason for his pain. And we made the first, when he stepped in my office, we made therapeutic plan together with the patient. So what we started. I told him that he will have to take drugs, because without drugs we cannot do anything. He had stiff neck. All but also we started with acupuncture the first day. So I integrated in the therapeutic plan non-pharmacological and pharmacological methods. And so he was visiting our pain clinic 2 times a week, because we make acupuncture 2 to 3 times a week. And all the sessions are, we make usually 8 to 10 sessions. And during this treatment, the muscles became softer, so then I could find the trigger point. So then, after 2 weeks, we could make the trigger point block. On the first day, I couldn't find any trigger point because he was so stiff. And he got he had to write a diary, and he was doing TENS therapy at home. So he had to take drugs and making TENS therapy, but he was so in pain that he couldn't start it with physical work, so he was not working in that time. And after the acupuncture, we planned to make hypnotherapy also. And when he was better, he was starting the physical approaches. So here is the integration of all the methods which we used with his treatment, like we call it therapeutic plan. So here are all the methods. So we started with acupuncture, then trigger point block. It is usually that with this kind of pain, the trigger point was here beside the scapula, but the pain was in the neck. So this is very usual with this myofascial neck pain. And this is in this therapeutic plan, I included this multimodal interventions, all at once. And as we can see, the pain path, we were hearing a lot of this today. These non-pharmacological interventions they are working on the descending modulation, on peripheral nerve, and locally. And I will talk now about physical treatment. So we know all that movement is very important, but we have to talk to patients to tell them what should they do. So this is education. And he was visiting also manual therapy and massage. And we can start also with heat-cold treatments or physiotherapy. Now about neuromodulation. I decided to include acupuncture in neuromodulation techniques. It is not invasive, because we don't do invasive acupuncture. It is very shallow. The needles are very shallow. So also TENS, transcutaneous electrical neurostimulation, is very important in treatment of chronic pain. It is very effective with our patient. And there are also other electrostimulation methods. We don't have time to talk about them now. And also traditional Chinese medicine, as I told you, 10 years ago, I think, or less, we started the Slovenian acupuncture school. So acupuncture is a treatment process, and as Dr. Požlep said, we use it very often. There are many theories. We don't have time to talk about them today, how the acupuncture works. We can make systemic or microsystemic acupuncture. I started in Slovenia with scalp acupuncture which was introduced by Yamamoto from Japan. So I decided to combine Yamamoto acupuncture with medical hypnosis. So I introduced this method in Slovenia. And acupuncture can be done also in distant places. It's very useful. So there are also a lot of psychological approaches. And I decided to our pain team, they encouraged me to start hypnotherapy with pain patients. And as I said, I combine it with scalp acupuncture. So medical hypnosis is something that everybody from us can feel every day. So it's like if we are doing something that we are very focused on, like driving or reading or watching movies. And it's also in the definition that hypnosis is a awake state when we are very focused on one thing. Then the medical hypnosis is doing on positive trance. So we encourage patients to do positive things, to think positive, and they are motivated to find ways and to cope with pain, and their fear and their pain triggers also. So the combination, hypnoacupuncture is combination of the two methods, the medical hypnosis and Yamamoto acupuncture. So I treat different patients with different kind of pain. I want to have motivated patients, and I make minimal 4 sessions in each in 1 month, and the sessions are individually tailored, directed with directed or indirected suggestions, and I learn patients to make their to learn how to do auto-hypnosis. So that's why I don't do more than 4 sessions, because my main goal is to teach them how can they do auto-hypnosis to themselves. So I would like to go back to my case. So he returned to work after 3 months. He accepted new position with less physical work. He had to manage a group of co-workers, so the work was more responsible, and he was more confident and motivated. And he told me that now he has control of workload. This is very important. Now I will invite my colleague to tell something about educational and research work in our department and faculty. Later we can go to questions.
So the learning of non-pharmacological methods starts at medical faculty in Ljubljana. The lectures are included in the course of perioperative medicine and also in the elective subject pain. We also encourage students to do research work on pain, and we also make some other clinical research. And last year we managed to publish some articles. Sorry. Our students published 2 review articles in the student medicine journal called Medicinski razgledi about chronic postoperative pain and treatment of facial pain. And of course, they included also non-invasive methods. We also published a review article of perioperative use of medical hypnosis and article about using hypnosis in awake brain surgery at our department. Our young colleague, Dr. Dopuna, published her student research work in two journals about non-specific lower back pain and its invasive treatment. We know that when we treat migraine with not just with pharmacological approach, but also with acupuncture, the results are better, and the reducing of migraine pain is better. So in present Presciren project, we compared two different acupuncture methods. In one, we used established local acupuncture points, and in the other one, we were focused on points on affected meridians. And the results of our study show that when we used established local points, the reduction of pain in migraine is better than with using points on affected meridian, as we were observing for the next 3 months after acupuncture was done. But we didn't find any difference in analgesic consumption, sick leave, migraine days, well-being, and migraine disability. As Dr. Markovic said, we sometimes use hypnoacupuncture for the treatment of migraine headaches. And in that Presciren project, we compared control groups where patients received 10 cycles of classic body acupuncture stimulation, and study group where we combine four let's say, sessions of hypnoacupuncture with body acupuncture that was done before or after hypnoacupuncture. We didn't find differences in headache intensity, analgesic consumption, nor in migraine days, impact on ability to work, absenteeism from work, and satisfaction with treatment. But when we look all patients, we found that there was a successful neuromodulation regarding reducing pain after 1 and 3 months when acupuncture was done. So both methods are a good neuromodulatory methods for migraine treatment, even if you didn't find differences between our group. We used medical hypnosis and acupuncture also perioperatively in patients scheduled for spine surgery to lower the opioids and antiemetics consumption in early postoperative period. And that study was prospective and randomized. Preoperatively, we performed medical hypnosis to gain patients' confidence. We teach patients breathing and mindfulness techniques about safe and pleasant place. And with this technique, we try to revive pleasant life experiences. Our patient was positively motivated. We encourage them to actively participate in healing process. Before anesthesia induction, we make a recall, or we use recall of positive suggestions to further reduce preoperative anxiety and stress response. So our patients were divided in 3 groups. The third group was control group that received pre-medication and standard anesthesia for spine surgery. And we have also group 1 and group 2. They both have preoperative hypnosis, and during surgery, patients got acupuncture needles at the selected points. The difference was that group 2 received additional antiemetic. So we didn't find differences between groups in analgesic consumptions, antiemetic consumptions, well-being, satisfaction, or hospital stay. So non-pharmacological methods are not better, but they are as good as just pharmacological approach, because in our study, there was no difference in early post-operative period in pain and in, let's say, anxiety related to the procedure, and both influence the patient satisfaction.
So we would like to conclude that in the future, we will also have to face with advancement in technology. Last week I was in Congress in Budapest, and I was talking to a student who is doing virtual technology during dentistry. So I was talking to him that we could cooperate. So I would like to make hypnosis, and he will help me with technical stuff, because this is something that we have to face. And so the multimodal approach is the future. We are talking a lot about it today, and integrative health in our country, I hope it will be more lively. Thank you.